I might be giving the results next week or after 2 weeks. Because dapat pala inuna ko yung onting sections kaysa sa maraming sections. Okay? Pero I will try to, as much as possible, finish all of the exams within this week so that I can give it out already by next week and then weeks after so that you will know your standing during the prelim period. But I think naman, di ba, with the groupings, with the quizzes, I think you're going to have a good score. Okay? So now let's start with access, ACCESS. And this is what we use in determining how are we going to communicate or how do we manage actually the patient in our own dental clinics. So this will be the contents, the ACCESS, or the accessibility, communication, consent, education, safety, and the spread. Objectives, and our objectives will be to be able to give an overview on the patient's accessibility, communication, ability to give consent, education, patient safety, and perform surgical services to persons with disability. And this is an introduction to the series. So your ACCESS, but your S, the surgical services, this will be discussed during. This will be discussed during the finals. So what we're going to discuss is access until safety. So first, to introduce the access series is the access part 1. We have been discussing this ever since prelim. If you have noticed, I have been emphasizing on the access always. Again, what is special care dentistry? This is concerned with providing and enabling the delivery of oral care for people with an impairment or disability. It is the improvement of oral health of individuals and groups in society who have a physical, sensory, intellectual, mental, medical, emotional, or social impairment or disability, or more often a combination of a number of these two factors. The special care dentistry is a diverse group of people with a range of disabilities and complex additional needs and includes people living at home, in long-stay residential care and secure units, as well as people who are homeless. So anyone who doesn't have an access to dental treatment is part of special care dentistry. In special care dentistry, but this is according to the 2022 study of what special care dentistry is. So in special care dentists that have graduated with the specialty title in the Philippines, if you will see, there is only 2 in the Philippines. It means that they have studied on how to properly manage patients with special needs. Because before, that's why in your generation, you are lucky because you are being taught on how to manage patients with medical conditions already. Because before, it was not taught to us. It was only just introduced. That if you are in the hospital, you will encounter these patients, then refer. Yun lang. But in terms of completely managing these patients, now, it was recently implemented lang. The management of patients with special needs. No, it was, I think, 2 years ago when it was implemented that it should be taught in the colleges. And now you are somehow well-versed when to refer patients. But in the practice of special care dentistry, it is not only that we are only allowed to do patients that are not medically compromised. We are encouraging general practitioners to handle these patients as well. It is for the accessibility of the dental treatment and management for these types of patients. If you know how to manage them properly, then better. But if you think that they are complicated, they have complicated issues, then that's the time that you know when to refer. Okay? I am a dentist who is managing patients with special needs as well. But I'm focusing more on pediatrics. If I'm going to handle an adult patient, I am handling adult patients as well. But if there will be cases, I do root canal treatment. But if there will be cases that in this special needs patient, the tooth is very complicated, then I can refer them to a specialist. So it doesn't mean that if you are a special care dentist, you have to do everything of the to do the treatment, everything on your own. This is where you will learn how to refer it to other dentists. To refer your patients to other dentists or other physicians. So as you can see, bago pa lang ang special care dentistry. In 2022, these are the number of dentists that has been graduated in a special care dentist master's program. And then if you can see in Malaysia, there are already 11. Because they have now a university who is catering a postgraduate masteral program for special care dentistry. And in the Philippines, there are 2, and they have graduated from Eastman University. And that is in Europe. So those are Dr. Bernardino and Dr. Ko. And luckily, I am both well acquainted in these 2 persons because they have been a good friend of mine. Even before they went to special care dentistry. And we have been conducting several seminars already. Dr. Kumar, one of the authors of Special Care Dentistry Handbook. Dr. Lim Wonshu, or David Lim, he is one of the very first dentists in Thailand. I think it's in Thailand. Singapore, I'm sorry, in Singapore. And he has been already, he already did lectures here in the Philippines. And the Philippines has its own organization for special care dentistry, which is the Philippine Society for Disability and Oral Health. Actually, this has been established since 1996. So matagal na, we are trying to introduce special care dentistry ever since before. But in the field of dentistry here in the Philippines, it was not yet recognized. When did it was recognized? 2 years ago. Okay? That special care dentistry is one part of the oral, one part of the rehabilitation of a patient, especially patients with special needs. Kasi before they thought that the Society for Disability and Oral Health, it is more on pediatrics. Because developmental conditions, they are found in pediatrics. So they thought that it was the same with pediatrics. That's why this was screened by PDA. But now, PSDH or PADHI, this is recognized by the International Association for Disability and Oral Health. That was when we, Dr. DC, and I went to Korea for the seminar under special care dentistry. So if you're going to go to conventions like this special care dentistry, you will realize a lot of things, the best practices that the different dentists have been introducing, that have been doing in their own practices, that you can apply it in your own clinics. So it was a very interesting experience, and there were a lot of things that needs to be implemented and needs to be shared to the general practitioners. Now, groups who require special care dentistry, those are people who experience disability due to the impairment of oral function and or structure, and who are limited in their activity and or participation directly by their oral status. In this case, this is a person or a patient with Pierre-Robin syndrome. With Pierre-Robin syndrome, either their jaw, it is fused with their skull. So they cannot open their mouth properly. So in this case, this is a patient where the jaw is fused with the skull. Then how will you do proper treatment on this? So we did modifications after the surgery. So this patient cannot open their mouth. As you can see, this was the patient's very first dental visit. That's why it was not properly taken care of. Look at the primary teeth, it is still present. Primary teeth, central incisors. Then, as you can see, these are the central incisors pala. I'm sorry, these are the central incisors, these are the laterals, these are the canines. If you're going to look, how will we suggest toothbrushing on this patient? So we really need intervention of other physicians. Clearances, surgical intervention. So the patient underwent orthodontic surgery, so they released the jaw from the skull. And now the patient can open her mouth this wide. So what is the role of the dentist? So we have to give suggestions to the patient for musculature exercise, because definitely the patient doesn't know how to use the muscle of the jaw. So what do we do? So what we suggest is that try to insert one stick until the patient can insert another stick and bite it for 5 minutes, twice a day, for 1 week, for the whole week. So it is an exercise that we do where the patient will try to open the mouth and we insert the stick. If the mouth can now open wider, we insert another stick, and another, until the patient can already open 4 sticks inserted. So that is one way on how to exercise the musculature of the jaw in terms of opening the mouth. In this case, so isipin nyo yung tongue depressor, yun the sticks na sinasabi ko. It's not that thick, but it is thick enough to insert for the patient, in the patient's mouth. So, luckily, with the proper modifications on treatment, like we did sealants on the posterior of this patient. So, with the 4 sticks na nakaka-insert sa loob, we did sealants on this patient with proper suctioning, with proper assist. That's why the assist is very important. They are not only there to do suction, but they are there to do the proper assisting. Nakapag-root canal pa kami dito sa patient. But with this, we have to extract this. When we extracted this root canal on this teeth, we did ortho treatment on the tooth. So this became centrals. Canine went down, minimal spaces na lang ang meron. So we have improved the patient's condition. So as you can see, there is an intervention or a talk between the physician, the surgeon, orthodontist, and the general practitioner. Diba ang galing? You didn't think na you can do sealants in posterior in a patient who had a history of fused jaw. So we did parang meeting with the surgeon, when will this be done so that we can do the procedures on this patient. So we are not only improving the aesthetics of the patient, but we are improving the quality of life of this patient. Okay? Next. People who have condition that has directly or indirect repercussions on their oral health. For example, in this condition, patients who undergo radiotherapy or chemotherapy, sometimes you will see patients looking like this. So how will you manage this? Without proper knowledge, you don't know how to manage. But if you will know how it became into this, or what are the things that you have to take note of, and the proper management of patients with mucositis, definitely you will know how to deal with this. Mukhang severe, but you will know how to reprimand the patient even before therapy happens. Because in patients undergoing chemotherapy and radiotherapy, they need dental clearance. And for dental clearance, before they undergo the procedure, you have to give them the instructions pre of the treatment. So patients that will be undergoing chemo and radiotherapy, you have to give them instructions. So take water, full water, water replacements, maintaining oral hygiene, salivary replacements or salivary stimulants, ice chips. You have to tell them that if they're feeling the burning sensation, they have to chew on ice. So before this happens, you have already given them instructions. Because if you have given them pre-op instructions, it will not lead to this type of condition. So that is the role of the dentist. Lately, some doctors, they know that they have to co-manage with dentists. Because in the hospital way back before, when I was still in training as a fellow, so the doctors that where their patients are undergoing chemotherapy, they have this burning mouth syndrome and they have a lot of sores. So meron silang mga mucositis. And they have this medicament or medication that they call the Magic mouthwash. It's a combination of 3 different medications. I forgot these medications. One is antifungal, one is antibacterial ata, and another one I forgot. It's a mixture of their consultant. But 1 week, hindi pa rin gumagaling, the mucositis is not managed. That's the only time that they will call us. So when they called us, we saw the patient, still a lot of mucositis, then we just told them to gargle with chlorhexidine, gluconate, 0.12%, yung alcohol-free. So if there are mucositis, don't prescribe mouthwashes with alcohol. So you have to prescribe alcohol-free. After 1 day, everything is okay. Tapos, wala nang mucositis si patient. Then, after several repeats of referring patients like that to us, sila na po ang nag-prescribe ng chlorhexidine. Di na kami tinawag. So, what do you call this? The Magic mouthwash, most likely they were used for fungal infections. Because fungal infections can be found in patients with depressed immune system, which are those patients who are undergoing chemotherapy. So as dentists, as you can see, you can help in providing quality of life of these patients. If you will be co-managing with the other departments, not only with interprofessional, but also with interdisciplinary. Another groups who require special care dentistry are those people who are disabled by their social, environmental, or cultural context, which reflects on their oral health. So this means that, when we have discussed during the year, the different stigma that the person has, especially if they are thinking that they are ashamed of themselves in showing to the public, or especially those patients with mental health problems, they are one of the people that really needs special intervention, especially for dentists. So we had this case. Again, you will see a lot of cases in hospital kasi than in private practices. So in PCMC, we had this patient. She is an adolescent. I forgot her age, but she was depressed because she was SA by her cousin. So what happened is that at 7 years old, that was the first SA incident that the patient had. And the cousin threatened her of showing photos to the family and scaring her that her family will cut ties with her if she will going to be exposing what they're doing. So she kept quiet. And that's the time where the parents started to notice the quietness of the patient. Until the patient was an adolescent already. I think 13, 14, or 16 at that age. Medyo matagal. So then the patient had the courage already. It was 11 years old. The patient had the courage to tell the parent. So everything was fixed na. So they are not meeting the cousin already. The cousin is a minor, 2. Then the patient is already taking medications. But the reason why the parent noticed this because the patient had totally no self-care already. The patient doesn't take a bath. That was the defense mechanism that the patient had for the cousin not to like touching her, to smell bad, to make herself not look pretty. The patient was really pretty naman. So that's what happened. So as you can see, because of their mental and social conditions that happened during the course of that condition, there was no self-care happening. So teeth were really affected. There was no brushing happen, no physical basta, di siya naligo, di siya nagtutoothbrush, di rin siya naghihilamos, she's not eating properly as well. So what did the adult department did? So they really had this good program where their patients will undergo parang, the president, lahat check up.
Easy executive checkup?
Ayan. You have the executive checkup. Parang executive checkup yung dating, where the patient will undergo different departments for general checkup of the patient. So when they came to the dental, the patient is already taking medications for anxiety and depression. And when we interviewed the patient said that she wants to fix herself already. She wants to gain her confidence back. That's why she's trying to make herself confident again after all the commotion that happened during her life. So when the anteriors were really bad. As in, the anteriors were all for root canals. 4 anteriors, upper and lower. So pinagtsagaan yan nung dentist namin. And the posteriors as well, they did root canal on those tooth. And the teeth that were extracted was only 1. So 1 extraction of the tooth of the lower 4-6 or 4-7. And the rest was root canal, direct pulp capping, everything was restored. Then patient was very happy. So as you can see, we can really help when it comes to bringing back confidence of the patient and to the point where the patient cried. Because she thought that it will never come back. Yung teeth niya, akala niya wala nang pag-asa. So not everyone with disability requires special care dentistry, as not all disability limits oral health. So persons able to express need and able to easily access mainstream dental services despite disability are not in need of special care dentistry. Okay? So disabled population. Disability tends to increase with age, and multiple disabilities are more likely to occur in old age. Oral health needs equal access to oral health care services and equitable oral health outcomes in terms of self-esteem, appearance, social interaction, function, and comfort. Again, what I have been describing a while ago, we can do a lot when it comes to the need of a patient, especially bringing them back to the society. Oral health needs people with learning disability or mental health problems, similar oral disease but poorer oral health and health outcomes from care. Because in these patients, they have just likely to receive dental treatment because of their condition. One, probably because of they will focus more on their condition rather than the oral cavity because of added expenses. Then if ever they will seek treatment, extractions are more done on these patients than restorations. This is according to the British Society for Disability and Oral Health, but now they are called the British Society for Special Care Dentistry. So they produce guidelines for oral health care and development of integrated oral health pathways to encourage the move towards equitable access, care, and outcomes. So they are the ones who were the first one to build special care dentistry. That's why there are a lot of special care dentists in the European area, in the UK area. They had this, what we call the case mix model. This allows objective assessment of the complexity of the provision of care for people with disability through a structured matrix. So this will measure the complexity of the patient. For example, in this case. So the case mix model criteria, the criteria is for the ability of the patient to communicate. Type of factor that is considered, you have to know if they need interpreters or for the means of communication or the degree of learning, disability, or dementia. Remember, we are not only dealing with pediatrics, but we are also dealing with adolescent, middle-aged, and especially geriatrics. Mostly, special care dentistry is more focused on after adolescent. Why? Because again, pediatrics covers developmental disabilities from birth until adolescence. Then after adolescent, who will take care of them? Then these are your special care dentists. So ability to cooperate, additional appointment time or acclimatization, visits required. Acclimatization meaning they have to be familiarized with the area or the need to use sedation or general anesthesia. When we do special care dentistry, especially for patients with developmental delay that are already considered adult, it is according to studies and according to the seminars that we have attended, nitrous oxide will not be, and sedation are not enough for patients with special needs, but it was recommended that you put patient under general anesthesia. For medical status, treatment modification required, degree of impact of medical or psychiatric condition on the provision of care. Oral risk factors, ability to carry out oral hygiene by themselves, dietary conditions like tight feeding or severe xerostomia, access to oral care, support of carer required, use of wheelchair, recliner, or host, or need for domiciliary care. When we say domiciliary care, these are persons who are already bedridden. Legal and ethical barriers, degree of capacity to consent, need to consult with other professionals or other family members, need to hold best interest meeting or case conferences. There are 4 key areas of access to oral care. So access to building, access to dental surgery, access to dental chair, access to the mouth. When it comes to the access to the buildings, there should be an alteration to physical access barriers. I haven't posted it, but we have, I had the opportunity to have a tour in the Seoul National University where they have this own building for special care dentistry. So in Seoul National University, they have 3 buildings. One is the medical hospital, one is the pediatric hospital, and one is for the dental hospital. They have their own building. And this is managed by an anesthesiologist. Okay? And in this building, they have these wide doors, and talaga, it was really an eye-opener. But there are lines on the floor. So when we ask where is the special care dental unit, they will just point at the floor, follow the blue line. Then we follow the blue, because there is language barrier, right? So they will say, follow blue line. Okay, follow the blue line. And we were already in the special care dentistry building. And it is in the dental hospital, there are 6 floors. 6th floor for oral maxillofacial surgery. 3rd floor is for the special care dentistry. And the 4th floor is for general anesthesia. And the 1st floor is for interviews. 5th floor is for pediatric. So all these 3 buildings are connected underground. And they have no papers. All of their charts digitalized. Wow! Philippines win. So alteration to physical access barriers. So if you're going to look at their room, half of this room, 1 dental chair. That big. Actually, this is small pa. Larger in that area. Pero half, pero more, extend a little bit more, that is 1 dental chair. 1 dental chair in the middle, then all of the things at the side. And 1 on the back. So that is 1 dental chair only. They have 6 chairs for this. So it was and their what do you call this? Central system for the charts, it's in the middle. But they have their own computers in each room to type in the procedures that they have. And they can get access on the medical condition of the patient through the main building, which is the medical building or the pediatric building. So ang galing. It was really wow. Hello, Philippines. Ganun po. Then another, because their doors and their way, it is really accessible with how your wheelchair will go inside. So that you see. And they have, in every patient, you have to get the weight of the patient. They have this carrier here, where they will put the wheelchair, weigh the wheelchair, then they will weigh together with the patient. So that is one way.
Sa Philippines.
If you see here, that is 1 dental chair for the whole room. Ayan si Doc Dixie pa ako.
Wow.
So this is the special care building, special care floor. So in this, there is another floor where we went to, where we do general anesthesia. And we all know that general anesthesia, they are done in operating rooms. But in the dental building, their general anesthesia is done beside the dental chair. So they have this one room where there is an observatory area. So parang observatory room siya. Thus there is a glass window here. There is 1, 2, 3, 4, 5, 6 chairs with their own general anesthesia machine. So all the staff, all the nurse, all the dental hygienists, all the anesthesiologists there are all for the dental building only. They don't go to the medical, they don't go to the pediatric building, but it is for the dental building only. So that is how advanced other countries are. So yun lang. Tayo, we are slowly getting there, I think St. Luke's is trying to be digitalized. Nahirapan na rin yung parents ko how to input patients' doctor's orders because they have to be digitalized. Kasi ayaw na rin nila ng paper.
Dami basura.
So staff attitude to compensate the physical barriers. As you can see, helping patients to cross over some of the areas, building ramps, building elevators, building ramps for these patients. Then access to dental surgery. When we say dental surgery, these are the dental procedures that we are going to do, or your dental clinic. So disability awareness training for all staff. Potential barriers to consider to access the clinic, like parking ramps, lighting signage, elevator, door width, door opening, position of door handles, non-slip flooring, communication aids, handles, and wheelchair maneuverability. One thing that I have noticed, that we have noticed in SNU, especially in the dental hospital, is that all tables are low. It is for patients those patients who are in wheelchair, that where they can move by themselves. So when they interview, it's not this high, but it is low. Even the hand washing toilet, it is low. Kami pa yung nag-a-adjust. Cute. Kala namin for pediatrics, but the director told us that it is for patients who are in wheelchairs. So very, very convenient for patients who are in wheelchairs. So everything was very low. So for example, in this case, as you can see, door is very wide. The area is very wide where you can move your wheelchair properly. And what can you see? The chairs. They are chairs only. The bracket tables, you will see it is separate. Okay? There are no things that are connected to the dental chair. It is for the accessibility of the patient to go into the dental chair. Yung pang-spit nila, it is in the, as you can see, it is connected on the table. So there are dental clinics looking like this. And look at the lights. It is on the roof, not attached to the dental chair. That is one way to modify your clinic for patients with special needs. Wider area, the better. So some, in Korea, ang dami ko kasi nakita doon. There are machines there where you think that pantaman for a normal person. But it is very efficient for a person with special needs. So they have this gargling machine. So, di ba, we ask the patient to gargle and spit. But for this machine that they are selling, they are just selling it for, I think, 100,000 pesos. It is a machine where you put, there is some kind of a tray, you put it inside, and the machine will be the one washing the teeth. And the machine is already doing the suction. So parang ilalagay lang dyan, mag-wash na yung teeth, then it will be suctioned by the machine as well. So it is very convenient for patients with special needs. They don't have to spit already or do the suctioning. So that is how advanced they are in catering these patients. Access to dental surgery, especially for domiciliary care. When we say domiciliary care, this is where patient is impossible to access dental clinics after acquiring a disability. Most likely, these are your elderly, yung mga bedridden or those who are already in institutions. To provide opportunity to communicate with carer who can offer advice and appropriate information directly regarding the patient's status. So for domiciliary care, if you can see, we can do things at their home. But you have to know what are the things that you will be doing at home. Remember, we bring dentistry at their homes. For those patients only who cannot go to the dental clinic. We don't do this on patients na, Dok, baka pwede naman kayo pumunta dito sa bahay. Okay? Because I have seen cases or posts where dentists offer home services for cleaning and restoration.
Ay, wow.
So please,
Masahe.
don't belittle this kind of practice. This is only for those patients who cannot go to the hospital or cannot go to the dental clinic because of their condition. Kung working naman ang paa nila, lumakad po sila. Okay? So we do this actually on patients, especially for elderly patients. We do impressions. Non-invasive surgeries, we do it domiciliary. Okay? Cleaning of teeth, doing minor restorative procedures, we can do it. If you know the portable, umuso kasi yung portable it became popular. The portable dental
Unit.
dental unit. So actually, that is what we are using in general anesthesia, the portable dental units. But it became popular because students need to do their procedures, their demonstrations at home. So it became one of the things where the students bought it. But now they are using it at home. So I have been hearing stories of some students of Fatima doing this type of procedures in their family and in their boyfriends, girlfriends.
Sin.
Yun. So please, do not do any malpractice. That is a malpractice, especially if it is not properly, if you are not properly trained for domiciliary care. Because it is not only preparing the patient on how they are positioned, but you have to have a certificate and a note that you will be doing domiciliary care in the barangay. Hindi lang basta-basta yan ginagawa. Okay? It has permissions. And you have to know where to place your clean, sterile, and dirty instruments. So decision-making process for domiciliary dental care. As you can see, confined to bed, if they are with O2 or with PEG-fed. If yes, automatic, domiciliary. But if no, are they a wheelchair user? Nakita niyo, dami pang question bago maging domiciliary care. If yes, they can do clinic appointment. Why? Because they can mobilize this patient. Okay, they can do ambulatory things on this patient. If the patient can go to other places, go to the mall, go to the park, but they can go to the dentist, iba na po yung tamad po tawag doon. So, if no, outings made. Ayun na nga, outings. Yes, clinic appointment. But if no, assess at home. Is it conservative or with extraction? If yes, they can be transported or not. If no, domiciliary. But you have to know the pros and cons because the limits of extraction is simple only. But if the extraction is, for example, third molars or impacted tooth, or you think that the RF will give you a hard time being extracted, then you do it in the hospital. Okay? You ask for a transfer with the ambulance. So I don't know if I have mentioned this before, but have you noticed ambulances na walang wang-wang pero dumadaan sila sa mga special lanes? So, or you will see, di naman emergency pero nagwawang-wang-wang-wang naman, di ba? Pero mga ganun, di ba? At first, when I was not working in a hospital, I was also one of the people who is annoyed. So ba yan ang ingay-ingay, sisingit-singit, wala namang emergency. But if you will notice, these are the only transport where patients can go from their area to another area. So I have learned that during my training time. So during training, patients will tell me, Doc, can we take advantage of the time that I am here? Because the ambulance that we have borrowed will be coming back next week or after 3 days. So we will sleep on the floor first. Diyan lang po muna kami sa labas, matutulog. Kasi masusundo po kasi kami after 3 days. And sundo nila, the ambulance. So that's why there are ambulances from Valenzuela, from Bulacan, you will see going to Quezon City because that is the only means of their transport. That is free. Free ang transport, pero may schedule. That's why that's the time that I learned to understand. So it's not for emergency cases only. But this is for catering patients who cannot go to one place to another because they have no money. Okay? So I hope you understand that better. Kapag umuwang-wang, hindi naman nagmamadali. It's because they have someone inside that needs treatment, but that's the only way of transport. That's the only way of their transport towards that hospital. So access to dental chair. Room for a wheelchair to be brought alongside dental chair for aiding in patient transfer to the dental chair. Or the use of wheelchair space for headrest attachments and patient dentist position during treatment. One of the things that we do in the clinic is, di ba, the headrest, if you will notice, some headrests, they can be turned the other way. Right? So what do we do? Even for patients with wheelchair, we put them behind the chair, then we just binabaliktad lang namin yung headrest and we ask the patient to rest the head on that headrest. So lock yung wheelchair, then put the head for headrest. So that is one way, without putting the patient on the chair. Another, if you can see the break leg chair, the old dental units that we had, it had a break leg chair. This is for patients who are non-mobile because they are only raising their body with their hands. And their feet and their legs keep on dragging. So this is one good on transferring patients. As you can see, patients who are having a problem when it comes to transferring from their wheelchair to the dental chair, the break leg chair is easy for them to go to the dental chair. Kasi nga, nakababa na. So, one of the Japanese units, they use mostly the break leg chair. Then you can use the banana transfer or transfer board. You will see na parang banana ganong shape. You will put it in the wheelchair and one and you will put it on the dental chair. Then the patient will be the one moving by themselves. Because again, some patients, they will not appreciate you helping them. Some lang. But again, it's a different culture. In the Philippines, they will appreciate it if you will help them. That's why better to ask if you want help. Because there are some people who will be not accepting of you giving them help. Di ko alam kung bakit. But again, in UK kasi, in UK and in US, you have to ask permission first before you actually help. Because they will think that you think that they are helpless. Okay? But in the Philippines, most will appreciate it more if you help them. But again, still, ask them permission. Next, the ceiling-mounted hoist. This is connected to the roof or to the... Make sure that the roof is not the wood. Okay? It is connected to a cement. Because this is where the patient will sit. Kung makikita nyo, para siya naka-cradle. Then there is a machine where the patient will be hoisted up. Then transfer it to the chair. So may mga ganon. Mga high-tech. There are different ways. Or you can have this one, the portable turntable. Di ba in a person, we ask the person to stand up. Then they are the ones standing up, pero supported natin. But instead of person, you can use this. A portable turntable, where they will hoist themselves up, move, then sit. Or the reclining wheelchair. So this is actually available in the Philippines, but it is not utilized properly. So as you can see, they can recline the wheelchair. Pero medyo mahal to, medyo mahal. You will see some parents from pediatric. Siyempre, lumalaki, of course, their children grows. So they become longer. So what the parents do, I see some parents, they modify the wheelchair. They just add some tubes for it to be longer. And they can recline it. Ang galing ng parents actually. So some parents here in the Philippines, they are very, very innovative when it comes to the wheelchair of their children. Access to mouth. For learning disability or challenging behavior, they does not have the capacity to understand what is required of them in the dental setting, especially for patients with learning disability. That's why you have to introduce the procedure repeatedly. So familiarization and behavior management techniques can be used to develop rapport and trust. So before you do the procedure, you have to desensitize the patient. So there is one procedure that was shared by a dentist, and this dentist is from US, where he kept on making the patient with special needs. So they have learning disabilities, pero adult na siya ha. At first, the doctor will say, oh, here's my needle, here is my injection. Here is my needle, here is my injection. At first, patient will move away. If the patient moves away, he doesn't move it away. And he keeps his hand on the mouth of the patient. Then repeat, needle injection, needle injection. Parang introduce of the needle injection until the patient is desensitized already. So needle injection, 1, 2, 3. Again, needle injection, 1, 2, 3. Then once the patient stops moving, after repeated action, then that's the time he gave the injection. And the patient did not react. So, iba-iba. There are a lot of different techniques that you can do on this patient. It was really amazing to see some dentists actually doing it. So actually, in the conference, there are really different views in regards in managing patients with special needs. In US, as much as possible, they don't want the patient undergoing general anesthesia or sedation. In the Asian countries, they always want general anesthesia. So it's safer, it's faster, and it will be less traumatic for the patient. But for US, they keep on suggesting that you can do different techniques without the use of general anesthesia. So again, depending on the behavior of the patient and how are you going to deal with things. So access to the mouth. This is one of the dentists that we have in PCMC on a patient with autism spectrum disorder. So at first, familiarization. He kept on introducing the clinic. What will the patient see the first time that they will go inside? What are they going to do? And he has this recording video where he will he shows the patient the sound of the handpiece and the low-speed handpiece. As you can see, he kept on repeating that before they actually had the patient come inside on their own. The patient is non-verbal. So what they do is they do the PECS system, or the picture exchange communication system. So in here, they'll show you first before they actually do it on the mouth. Without the use of without using Papus board. Because they want to develop the behavior of the child or the adolescent without the advanced techniques. So you can do it. You can do it. So oral and general muscle control or tone. So we have different kinds of muscle control. The non-steady anatomical support, the chair positioning for medically compromised, risk for self-inflicted or unintentional injuries, and impaired or exaggerated gag reflex. Madalas you encounter this in pediatric patients. The very sensitive gagging reflex. For non-steady anatomical support, you can have your bean bags. So there are frail, spastic, and hypotonia. When we say hypotonia, weak muscles. Spastic, ito yung mga tumagalaw-galaw, like your patients with Parkinson's disease. Then frail, these are weak patients in general. So as you can see, for these types of patient, cushions, support cushions are good. So for cerebral palsy, patients with Parkinson's disease, patients with anatomic problems, you can use these support cushions. They have this specific support cushion where para siyang beanbag in a plastic where the patient will sit, you put it under the legs, you put it on the patient's head, then you vacuum the air inside. Because this will shape, will properly hold the head, will properly hold the legs. And it will not move or will be parang, fall down from time to time. So there are some cushions looking like this. Pwede ordinary unan lang. Anything to support under for patients with rheumatic conditions. Di ba hindi na nila kasi na straight yung hands nila or yung legs nila. So as you can see, the patient cannot put it in the proper position. So what do they do? What do they did? They put support cushions. Hindi nila pinilit ilagay dun sa support area, dun sa armrest. But they have supports for that. Legs din, ilagyan naman din nila ng support. Another safeguarder, leg relaxer, Velcro straps. There are some dental chairs with Velcro straps. Okay? So they can do this. You can do this. Kita nyo, daming una. Very comfortable for the patient.
We have patients that sleep on the chairs like that. Imagine this once.
Huh?
We have patients downstairs that sleep on our chairs. The regular chairs we have downstairs. If you give them this one, they will never wake up.
No, this is for patients with special needs pa talaga. Give them unan, but we will give them pillow if there are well patients.
Give them blanket pa, no?
So you only do this for example, patients, because there are some patients who cannot put their legs straight. So especially for rheumatic conditions, where their bones are already compromised, their joints are compromised. So you put the support so that it will not be hard for them. Okay? Not patients are well. Then chair positioning for medically compromised. So especially for COPD patients or any patients with breathing problems or congested conditions, like there are some cardiac conditions which are considered congested, meaning they have problems in breathing. Don't lie them in a supine position. What is the best position? Semi-supine or the 45-degree position or sitting position. Or you can add an oxygen to the patient for breathing. Again, if they have breathing problems, don't lie them in a supine position. Then you ask, how many pillows are you using when you do resting or when you do sleep? 3 pillows up. So it means that they have problems in breathing when they are lying in a supine position. So you modify. We are the ones adjusting to these patients for them to have a very comfortable dental treatment. For risk of self-inflicted or unintentional injuries, we do bite supports. Okay? Again, your mouth gag, your mouth props, and your, as you can see, meron dito yung parang, ano yung cone na orange sa road? Yung mga cones, but in here, as you can see, cone din siya, pero may protection against the lips. So you can use that to open the patient's mouth. And again, same as in pediatrics, control the head. As you can see, they have controlled the head before brushing or before doing any oral procedures on the patient's mouth. Okay, you can teach this to the carers, but later na yun, sa carers na yun, sa education. Again, when there is problem in opening the mouth, you can use the bite supports. Ayun, bite support pala tawag dyan. So it can be bought. But make sure that your hands are clean before you do it. Impaired or gag or exaggerated gag reflex. So people who have impaired gag reflex because of either dysphagia or other neurological conditions, they may need to be treated in a semi-upright or sitting position. Okay? They are not to be treated in a lying position. But how will you know if it is just an exaggerated gag reflex or just a false gag reflex? Especially for patients with autism spectrum disorder. Because they realize that when you enter something inside their mouth, once they do that, you immediately go on, put it out. So it is one way of parang it was devised on them na, if I do that, they will not put it in my mouth. So kahit wala pong ginagawa, gaganon. So that is one way on assessing or if they have really exaggerated gag reflex. Another, try putting your finger inside, then touch, palpate the palate. Not the soft palate, but the hard palate only. If they can tolerate the hard palate, try moving it inward path and palpate. If no reaction, that's okay. Again, on the lower part. And sometimes we ask the parents to do desensitization. So do this exercise of palpating the palate and under the tongue until to the lingual of your molars. If they will still do that, like that. Because sometimes it's not. Sometimes they will have rewire the system that this is not something to be in a gaggy, not something to be gagged off, gaganon. Okay? But there can be different ways on how you can stop the gagging. You can ask the patient to drink cold water. Distraction is very effective. For example, okay, you count. What is 1 plus 1? When you're doing a note, 2. Or tap your forehead so that you will not gag. It will stop gagging because it's something psychological. The gagging reflex. Or you can do this. Isolation. Rubber dam isolation. So there are clinicians downstairs who says that the patient has gagging reflex. Okay, isolate. Dok, nagagag po sila. Isolate. Then when you touch naman the lingual, not gagging. Touching the palatal, not gagging. When the clinician is inserting now, taklang bleh. Sige, let me do it. Nung nilagay, wala nang okay. Nakakasuka? No. So, but sometimes you have to look at the throat of the patient. Sometimes if their tonsils are big, they easily gag. So relaxation exercises like deep breathing or self-hypnosis is effective. You just have to make the patient not be aware or not be conscious of what is inserted in the mouth. There are older patients downstairs too that they will, when you take impression with the modeling compound, they will do gagging. So what will the clinician do? Put it out. When you're supposedly to put it in lang. Hinga po sa ilong, breathe it through your nose, touch your forehead, raise your foot, anything that will distract the patient, just not to make them think of the tray that is inside their mouth. That is effective. You can try it. Psychological therapies, behavioral therapies, conscious sedation, acupuncture, and acupressure. So they are effective. So sedation or general anesthesia in cases when behavior management techniques won't allow provision of good quality and safe delivery care, particularly for those patients with more profound or complex needs and or challenging behavior, you do your general anesthesia. Again, depending on your assessment to the patient and the agreement that you will have between patient and dentist is when you will be doing your general anesthesia. Okay? So communication, medyo mahaba to. This will be for next meeting.
Yay! Kasi kataho.
Medyo mahaba. So dalawang C. So for communication and consent, it will be next meeting. Okay? Any question? O, gising na? Gising na? Any questions? Clarification or concern? None?
Singatin mo to, singatin mo.
So if not,
Punta ko sa ingat,
we
ingat.
go.
Singat, singat, singat.
Ano ba silok ba kailangan?
Oh, figure of eight.
Figure of